Continuing now with the Impact segment, how are Republicans viewing the health care reform situation as it stands now? Joining us from Washington, Congresswoman Michelle Bachmann, a Republican from Minnesota. I just heard Congressman Sherman say, look, we're paying for these people anyway. They go to the emergency room. Something matter with them. We got to treat them free. So why not get them on board? That'll bring the cost down. And you say?
Well, there is a cost when they come into the emergency room, but there is no comparison to the cost of having this massive government takeover of health care. It's just a fraction of what you're looking at, and also you're taking 85% of Americans who are happy with what they have today for the most part, and you're forcing them into a new system that they aren't very sure about, but they know it's going to cost them more money.
All right, I'm one of those Americans. I have a health care plan through my corporation, and I'm happy with it, but I'm not happy with the insurance company raising my rates every year, and then when I want to put in a claim, I gotta dial 1 for Spanish, 2 for Farsi, 3 for Estonian. It takes me an hour to get a person, and then I'm disconnected as soon as I say I want them. I got a bad connection. You know what I'm talking about. It's hard for me to warm up to these insurance companies.
Well, that's right. And the best thing we could have done is to take away the monopoly that insurance companies enjoy in every state in the country. That, unfortunately, wasn't done in this bill, but that's the best thing that we could have done. And we could have dealt with things like pre-existing conditions, but we didn't need 2,700 pages of a document in order to do that.
All right. I asked this to Governor Palin. What is the worst part of this bill, in your opinion, the absolute worst?
Well, I'm a former federal tax litigation attorney, so for me, it is putting the IRS in charge of enforcing this health care bill. I know that sounds strange to your listeners, but President Obama decided to put the IRS in charge of administering this system, which means every month IRS agents will verify whether we have insurance that's acceptable to government. They'll also verify every month whether employers are offering acceptable to government health care. This means hiring about 17,000 new IRS employees, and they'll have extraordinary levels of power, Bill. They'll be able to issue levies, fines, taxes, penalties, interest, and now for the first time they will share our confidential tax information with the Department of Health and Human Services. That alone should raise the hackles on everyone's neck to think that now we have the hassle of the IRS in our life every month verifying that we have bought insurance, not that's acceptable to us, but it has to be acceptable to government.
Now, who would you have put in charge rather than the IRS of monitoring that people do what they're told? Because that's what Obamacare is. They're telling you you got to buy it, some kind of program. Right. You don't do it, there's got to be a sanction. So who would you put in charge?
Well, number one, I wouldn't have this system at all.
I know that. I know.
Right.
But if it's
that's
in,
on the table.
Who would run it?
Well, I think it should stay with the Department of Health. I think that's where it should be administered, but not with the IRS.
But they don't have any enforcement capability other than to close your restaurant down or something. I see what you're saying. The IRS is intrusive just on its own. Now,
well, it changes the nature of the IRS, too. The mission of the IRS is collecting money. But, Bill, you're going to love this, because now every American is a captive audience to the insurance industry. This wasn't Republicans trying to protect insurance companies. Now President Obama has forced 300 million Americans to come calling to insurance companies, and the IRS is the collection agency for insurance companies. The IRS will send $500 billion to insurance companies.
Well, why are they sending $500 billion to insurance companies? For what?
Because they're collecting the payments that will go to the insurance companies.
I got it.
That's what the IRS is doing.
Okay. But if I buy my insurance from my carrier, who I've been with for a long time, despite their difficulty dealing with them, the IRS is going to leave me alone, right?
Well, remember, your insurance has to be acceptable to government,
they'll have to
not to you.
It. Right.
That's right. And so then it will always be up to the government can always change those requirements.
Bottom line is, this is, in your opinion, and many Republicans and conservatives agree with you, a huge federal power grab. It heightens Washington's power, and individual power shrinks.
Yeah, there's no question. This is an 18% takeover of the federal economy. And again, this is one party that is doing this. So the Democrats want this. They will have to own this bill. They'll have to sell it to the American people because right now the American people aren't on their side.
Well, they got it. And then they'll just have to take the repercussions of what happens afterward. Congresswoman, always a pleasure to have you on A Factor. Thank you.